My name is Katie, and I've been a Michigan resident for 35 years. I graduated from the University of Michigan with a Bachelor of Arts and Bachelor of Science in Nursing. I'm in my 11th year of nursing, and I've worked for a very prominent healthcare system in Michigan since 2014. I am, or was, an educator on a general practice unit where we do care for COVID patients, most of which are fully vaccinated. The threats from my employer all started in March of 2020 when I, like many others, received an email stating I was deployed to help during the pandemic and to care for COVID patients. If I did not accept, I would be suspended for 3 days, offered the same assignment, and if I refused, I would be fired. I was deployed for 3 months and, like many others, received no COVID pay while caring for COVID patients. We did run out of PPE on many units and many hospitals. No one likes to hear this, but it is the ugly truth. We made it work because we had no other choice. We risked our lives and the lives of our families. Many of us left our shifts feeling like a walking biohazard, like we were the virus. People shunned us, and we shunned other people out of fear. The isolation, the physical and mental strain, and the emotional strain taken on by the healthcare community is tremendous. We stepped up to serve, and the people called us heroes, a title we did not ask for, but that we earned through our service. In June of 2021, I received an email from my employer threatening termination, this time for noncompliance with their COVID vaccine mandate. The hospital offered COVID listening sessions for staff to ask questions. I attended and did ask questions respectfully. Shortly after, I was greeted by leadership and administration stating that they noticed I was at the sessions and that I seemed distressed. They said I needed to take a week off work to think. I was told that as a leader, it is not my job to question policy. This was followed up with an email from administration stating I would be off work for the week and I needed to report to them upon my return. When I did return, I was pulled aside for a meeting with administration in the middle of my 12-hour shift with a 6-patient assignment and a nursing student. I was warned that I could have been fired for my questions at the listening sessions. I was warned that as a leader, I must get on board with what the system is doing. I was told not to answer any further questions regarding the COVID vaccine. I was offered help finding another job and told that if I disagree with this mandate, I should be respectful to leadership and administration and resign my position. Since then, I've been pulled aside almost every shift and asked, for example, do you have questions about the mandate or your termination? Or how do you feel about me posting your position? They are taking a head count and actively attempting to fill our positions before we are even gone. It's disgusting, it's constant harassment, and it's true discrimination. Managers have been sent a list of employees on their unit who have not been vaccinated. These staff are now being pulled aside one by one and questioned. They are being pressured, coerced, and intimidated into receiving the vaccine. They are being told they won't be able to find other jobs in healthcare, and those in school are being told they must comply in order to receive future education. We have now been branded anti-vaxxers and have scarlet letters on our chests. I ask you, what happened to HIPAA? Is medical segregation okay? Should we also be stripped of our right to bodily autonomy? Do we really not deserve a choice? The hospital is now offering a $10,000 sign-on bonus for nurses and $25 extra per hour for extra shifts. They are actively recruiting Canadian and agency nurses. Please, I ask you to consider who will care for you when these hospitals force us to voluntarily resign our positions for refusal of vaccine mandate. After working through this entire pandemic and risking our lives, they will even make receiving unemployment a challenge. Please remember, healthcare workers did not get a COVID vacation to sit safely at home and receive extra government stimulus from their couches. This is a term I've really grown to resent. We worked and we risked our lives for the patient, the same patients we are now being deemed unsafe to care for. We may be in a vulnerable position, being hit when we are already down, but we will not be taken advantage of, and we do deserve a choice. Let's be clear, we are not being presented with a choice from these hospitals. We are being presented with an ultimatum: do it or else. We are being forced to decide between risking debilitating injury or death from this experimental vaccine with the highest mortality rate in history, which of course will not be covered by the manufacturer, government, or hospital, or losing our jobs and financial stability. Many nurses are leaving healthcare altogether. Exemptions are not the answer. We should not be forced to apply for an exemption from a mandate that is unconstitutional in the first place. Freedom is the answer. We went from hero to zero, essential to completely expendable. Please help us. Help us to protect our freedom of choice. It's the best things you can give to all healthcare workers and to your community. Our body's our choice, and we ask you for liberty and justice for all.
Thank you so much.